Hello everyone, and thank you for joining us for the American Journal of Managed Care's Healthcare Reform Stakeholder Summit, Fall 2015 Peer Exchange video program. My name is Dr. Dennis Scanlon, and I am a professor of health policy and administration and director of the Center for Healthcare and Policy Research in the College of Health and Human Development at the Pennsylvania State University. Joining me today on the panel are Leah Binder, President and CEO of the Leapfrog Group, Dr. Austin Frakt, a health economist for the Department of Veterans Affairs and Boston University, Peggy O'Kane, President of the National Committee for Quality Assurance, and Matt Salo, Executive Director of the National Association of Medicaid Directors. Thank you again for joining us, and let's get started. So I'd like to start this morning by talking about one of the most significant and also most controversial parts of the Affordable Care Act, and that is the expansion of Medicaid. Austin, maybe I'd start with you. The expansion of Medicaid has had implications across the healthcare industry. Some states have decided to expand, others haven't. Of course, there have been legal challenges. I was wondering if you might talk about how it's impacted the healthcare industry thus far.
Okay, so what we're seeing across states are some of the things that we might expect. So states where there isn't Medicaid expansion, health insurance coverage rates are lower and they're not growing as quickly as states where there has been Medicaid expansion. And Medicaid expansion, because it brings in a lot of federal dollars, they're paying the complete load of a Medicaid enrollee's, a new Medicaid enrollee's expense, at least for a few years, brings in a lot of dollars into the state and into the health system in particular. So states that haven't expanded, they're not benefiting from that. So you're seeing hospitals with tighter margins, maybe negative margins, some closures in rural areas, and the state in general is not getting an economic boost that it would otherwise, and that has ripple effects throughout the state economy. Finally, we know from careful studies that Medicaid has positive impacts on financial health and well-being, and so these benefits are not accruing to states where Medicaid has not expanded. So citizens in those states, low-income citizens, are not as well off, frankly.
Mm-hmm. Peggy, a lot of people are concerned with expansion about making sure we get value for care, and I imagine that really has had impacts on the way you think about quality measurement and how you measure quality across a variety of states that have different programs.
Yeah, I mean, I think that there's always a tension between the desire to be able to benchmark across states so you can see who's doing well and who needs to work harder, and the desire to have state-specific measures. I think that there's often a belief that my state is different, and our states are very diverse and so forth. So that tension's been going on for decades, and I expect it to continue, although I was pleased that in the recent Medicaid regs that were, the notice that was put out by the federal government, there seems to be an understanding about the importance of benchmarking, so I think that's great. I think that there's another development with Medicaid, which is not necessarily related to the expansion, but that has very, very important ramifications, which is putting people in managed care now who are vulnerable populations, the mentally ill and so forth. And I think we're going to talk about that more later, so I won't go into that now. But another opportunity is that 51% of births now are in Medicaid, and we have opportunities to improve birth outcomes, particularly low birth weight babies, the use of C-sections and so forth. So I think, otherwise I think that the measures that we have are actually pretty good for a lot of the Medicaid expansion populations. The ones that we use for commercially insured people and the ones for the TANF people, those all work. It's the special populations where I think we have the big challenge now.
And we will get into that. Matt,
yeah.
You have an interesting perspective since you have a lot of constituents in many different states. What are you hearing from your constituents around the country about how Medicaid expansion is playing out? And one of the things you mentioned earlier was that a lot of there were a number of states where some of these changes were happening even prior to the ACA.
Sure. So I think there's a couple of things going on. Clearly with post-Supreme Court, with the Medicaid expansion decision being placed squarely at the state level, we've seen a lot of states do it, but a lot of states not. I represent all of them, all 56 of the state and territorial Medicaid agencies, and to a person, they all firmly, strongly support and defend the Medicaid program and what it's done for the 70 million people who rely on it today. But I think at the end of the day, the question around the expansion is not so much should we expand coverage, it's more what is the best way to go about bringing new insurance coverage to low-income Americans and tens of millions of more Americans. And that's what a lot of states are struggling with now, is how to make a Medicaid expansion politically viable in a state like a Florida, in a state like a Texas. And as Peggy said, a lot of the things that, a lot of the really exciting things that are happening, whether it's quality measure related or whether it's delivery system reform or payment reform, a lot of those predate the ACA, and a lot of those efforts are completely independent of the decision to expand. And they really run the gamut. You've got delivery system reforms, whether it's putting individuals into a managed care organization, so an MCO. There's the ACO in Oregon. There's a coordinated care organization, a CCO. There's an RCO. There's lots of acronyms. But the important thing is that the main thrust behind what all states are trying to do is better organize the delivery of care around the patient and to try to figure out ways that we can incentivize the system to get people healthy and keep them that way.
So, go ahead, Leah.
I wanted to add to Peggy's point about maternity care being a very important piece of this, because sometimes we get caught up in talking about Medicaid or Medicare, and we forget that Medicaid does not deliver any kind of health care. Medicaid is a way of financing the delivery of care. And I think what's really important, and where we've seen successes in states, is where there's alignment between private sector purchasers and Medicaid programs that are looking directly at the delivery systems, meaning the physicians, the nurses, the hospitals, where care is being delivered, and really lining up forces to improve that. Maternity care is a great example of that. In maternity care, I think one of the great successes has been early elective deliveries, which are these deliveries scheduled too early for not a medical reason. We've seen Leapfrog monitors early elective deliveries, and we've seen the rate go from 17% when we first started reporting on it in 2010 to about 4% now. And that really has been some incredible efforts, like in South Carolina, for instance, where you see this alignment between the interests of Medicaid and private sector purchasers. And again, that's when we're looking directly at the delivery of care. And I think that's a very powerful and important lesson for us as we go forward with expansion.
If I might add to that, I just heard a few weeks ago about a maternity medical home program in North Carolina. Now, North Carolina is an unusual state because it has a network of public health nurses. And the brilliance of the model there is they've pulled the public health nurses into partnership with the OBs that are the maternity medical homes. They have quality measures and so forth. And they've already been able to bring their very low birth weight rate down by some noticeable percentage. I think it was around 10%. So it really is about creating the right synergy with the delivery system. And the conditions on the ground in each state are different, and taking advantage of the natural resources that you might have in the state or the natural advantages, I think, is part of the magic.